young people are the key to this. As you can see today, there's an awakening of young people's involvement and participation in this issue, and it's really a partnership between us as the sort of advocates and reformers, clinicians working in this area, and them and their families. And I think when the politicians and policymakers see this, it'll strengthen their arm, it'll help them to make the changes that are necessary in terms of reform and investment, in I guess designing and implementing new cultures of care and a new awareness as well in terms of health seeking. Well, I think we need three things. One is much wider sort of awareness and willingness to seek help, and overcoming that sort of internal sort of resistance to seeking help, because that was one of the things that's been talked about at the conference today by young people and by Clyde Rathbone as well. So that's number one, sort of help seeking and awareness. The second thing is having soft entry, systems, youth-friendly systems of care where you can just, test out the trust, test out the culture, and see whether you want to actually trust that approach, that service. And I suppose Headspace has pioneered that approach, and also now we have eHeadspace, which is another way of just dipping into it and just learning a bit more before you actually commit. So there's the primary care level, if you can put it that way, the entry level, and that can absorb a lot of the need actually in simple, safe sorts of interventions and support. Thirdly, we need a backup system. So if it's more complex, or if the simple sort of kinds of support and interventions don't work as well as we might have hoped, there's expertise that we can draw on in a more specialised, youth-friendly sort of system as well, which currently we don't have. We've got traditional child psychiatry, we've got traditional adult psychiatry as the backup system. They're just not appropriate fit for teenagers and young adults. We need a new, dynamic and flexible and agile system of specialist youth mental health care as well as Headspace. We haven't seen any significant reductions in suicide in recent years. It's at a very high level, 50% higher than the road toll. We've got to rethink the whole approach. And this timid approach to talking about it, which has been reinforced by professionals and researchers, is clearly not working. We've got to talk about it. Obviously there are a few traps for young players in talking about it. We don't want to romanticise it or idealise it or make it unreal. So the 3G in heaven thing is the key. But the way to deal with that is full frontal. We've got to show what actually happens with suicide. It's a permanent thing. That people are devastated, the ones left behind, and there's no way back. Now, we've got to do that carefully because it's a big change, and it's making a lot of people anxious, but we're not going to get change unless people are anxious. So there's a way that social media can actually be a negative, but what we saw in this case, with 18,000 young people developing their own sort of Facebook site to actually support people and provide scaffolding and support for young people in trouble was inspirational, I think, because the young people are actually providing intense support to people who are near the edge of the cliff, and they also showed escape routes. They highlighted all the sources of help that were available, the helplines and the avenues to recovery and getting relief from the emotional pain, and I think young people have shown a leadership that's been lacking actually amongst the adult community on deliberate self-harm and suicide. Well, I think we saw in the audience that there's still a fair bit of stigma and self-stigma within the young people, so that they can help to dispel that by talking more openly about it, by reaching out to their friends. I think it's Are You OK Day this week, and that sort of idea, that just normalising the fact that it's okay to talk about distress of various kinds and facing up to it. The high school students can actually act as mentors for other younger students. That's like a stepping stone into professional help. That has to be organised within schools, and there's some programs in Sydney that I've seen where that's been very well organised and links up with Headspace and school counsellors. I think getting over the kind of reluctance to see a school counsellor is another thing they can help with, because the school counsellor that spoke today was extremely wise and astute, and I think the young people realising that that's available to them, would be another sort of advantage too, and not just think it's a bad thing to do or a sign of weakness.